On the 12th of January, I was riding my beautiful seat moper on my way to the office when I rode over some oil. The total loss of control that happens when someone on a motorbike rides over oil is absolutely indescribable. Basically, it's like the bike entering a lake of ice. Obviously, I ended up on the ground with a heavy impact on my knee and a completely shattered knee. An ambulance was called. I was extremely well helped by people who stopped their cars and protected me from the traffic because I was in the middle of the road. When the ambulance arrived, I was taken to Beatriz Angelo. And this video is very much about what my experience at Beatriz Angelo was like. The first thing that happened was, in 2 hours, they did absolutely everything that needed to be done for me to receive initial care was carried out. Namely, they did an X-ray, identified where the fracture was, immobilized the fracture by putting a cast on my knee. After the cast, I had a CT scan, and it was about midday, roughly 2 hours after the accident, 1 hour after arriving at Beatriz Angelo, and I had received all the initial care that needed to be done. Afterwards, things started to go less well. I found out at around 7 in the evening that I was supposed to call the work accident insurance so they could eventually transfer me to another hospital, have the operations I needed, and so on. And I had no idea about any of this. They only told me at 7 in the evening. Needless to say, by calling the insurance at 7 in the evening, I wasn't transferred to the hospital at that time. I spent a night at Beatriz in the A&E. And the experience is absolutely surreal. Well, let's start with the afternoon, between midday and 7 or 8 in the evening, when I was in the orthopedics corridor, along with more than 3 or 4 bedridden people, and with a nurse and an orderly, who, well, were hands-on and managed to look after us. The hospital experience is something, for anyone who's never had it, extremely strange. Because the dehumanization of the client, the patient, when they're there, is tremendous. It's tremendous. We're stripped, we put on the hospital gowns, the hospital underwear, and so on. And we're just lying there on a stretcher. I, for example, couldn't move because my knee was immobilized. And basically we wait. And waiting means waiting with other people suffering around you, obviously. Complaining, calling for the nurse, and so on. And in my particular case, for example, there was a gentleman who had dementia, must have been about 90, I think, and every 5 minutes he would ask to go to the toilet. And he would beg to go to the toilet. The first few times I saw that interaction, what I thought was that the gentleman really did need to go to the toilet. And these assistants, these nurses, are absolutely heartless. I mean, aren't they going to help the poor man there in distress? Later, I found out, a few hours later, that he actually went to the toilet every 4 hours, and that 5 minutes afterwards, the whole performance would start again. It made an impression on me. Mental illnesses always leave me a bit unsettled. I was there with my AirPod Pros, basically trying to block out the background noise and to isolate or distance myself as much as possible from that reality. The biggest problem came at 8 in the evening when they took my stretcher and basically wheeled me into A&E. And A&E is hard to describe because it's a sea of stretchers, all crammed together with very few nurses, orderlies, and so on looking after all those patients. Honestly, I don't know how you could do that any better, more efficiently, and so on with so few resources. And I'm convinced that what I witnessed isn't very different from what I would have seen 10 years ago. So it is not about the decline of the National Health Service. What it's about is too few orderlies, too few nurses trying to look after dozens of patients, and even fewer doctors, who in turn would attend to the cases that seemed most urgent. That night, I believe that most people, unless they're really unwell, won't get a minute's sleep. There's always someone in a ward making noise and so on. I saw a gentleman who was saying he was having a conversation with his mother. Suddenly, out of nowhere, he started explaining to the little lady that she couldn't interpret it that way. The only thing he wanted to do was help her with something. So he was talking to his mother with an incredible tenderness. This gentleman was 90 years old, so I presume his mother has been gone for a long time. And he was delirious, hallucinating. And I spent 40 minutes, something like that, listening to what he was explaining to his mother, what his part in the conversation was. It really struck me. It struck me because obviously I was there with my shattered knee, but still in much better shape than most of the people around me. I knew that sooner or later I would be transferred to a nicer hospital where I would have better conditions and so on. But I witnessed what I would describe as hell, where there are angels, and these angels are the medical staff. I saw nurses, both men and women, with endless patience, helping people in pain, giving them painkillers, checking on them countless times, responding to the same request, the same call, over and over again. Honestly, I have no idea how people survive that. I have no idea how they manage the empathy they must inevitably feel for other human beings. They could be studied. Incredibly kind. For example, I remember that in the middle of the night, I wanted a glass of water and I didn't have the heart to wake anyone up. The people who, in that rare moment of peace, could get a bit of sleep. So I used my phone's torch to get the nurse's attention. She came over to me, incredibly friendly, saying, "You can call me by my name. I'm a nurse." I can't remember her name now. "And whenever you need me, just call." I thought that was absolutely remarkable. I explained to the lady that I just can't be in this situation and do anything that might wake up the people who are there. If I can avoid it, if I'm not in excruciating pain or anything like that, I'll do everything I can to disturb the people in that situation as little as possible. And that was it. It was a whole night without sleep. The AirPods Pro with their noise cancellation were honestly a blessing. Because I was able to keep listening to YouTube videos, podcasts, and so on, which in a way took me out of that environment. Every now and then my ears would start to hurt, obviously from having listened to videos for 18 hours straight. So I take the videos off for a bit, and that's when I witnessed those cases of the man talking to his mother and so on. It was intense. It was a lesson in humility. Those people who were there, absolutely brilliantly. And honestly, from the bottom of my heart, I'm extremely grateful for the care they gave me that day. After 36 hours waiting to be transferred, other angels appeared. That is, an ambulance team who picked me up and took me to a private hospital, according to the insurance from the company I work for, where I arrived. And instead of having bread and butter, being in a sea of stretchers and so on, suddenly I had a room to myself where they gave me dinner, because I arrived at the hospital around dinner time, where the nurses dedicated their time and attention to making sure I was all right, if I was in pain and so on. It was absolutely fantastic. I spent a week in that hospital, and that's where I am right now. Where I'm recording this video, I'm going to have surgery the day after tomorrow at 2 p.m. to reconstruct my knee, and then I should be discharged 1 or 2 days later. In other words, I literally spent a week here just waiting for the operation. But it was an odyssey. It really was an odyssey. And in fact, when people are very vulnerable, I'm not sure there's a better remedy than the one I witnessed. What are they supposed to do? They go to comfort the patients who are already in the emergency room and leave the others outside, dying without supervision. There's no way around it. So there are truly exceptional people doing an extraordinarily difficult job. And yes, it is deeply sad to see people whose health is so terribly deteriorated. I remember there was a gentleman who was having a catheter put in, and he was in a lot of pain. The nurse was complaining that the gentleman's prostate was ruined. And all those treatments are carried out with people just 10 centimeters away from us, on a different stretcher. So just imagine what it's like to spend an entire night like that, one after another. Cornello. It really is absolutely astonishing. But it's good to know that these angels exist. And we can say whatever we like about the National Health Service, but a person is treated, is looked after, with more or less discomfort, and may well survive. Which is not something you can say in many countries around the world, especially in the United States. In a situation like this, an emergency, at the very least, a person will end up declaring personal bankruptcy. Our system makes this possible. I have absolutely no doubt about it.